Now we will hear about the importance of proper posture analysis and spine health assessment from Dr. Suman Tadagonda. He is MD in sports medicine and a specialist in spine movement and athlete health at Ensure Healthy Spine Private Limited. So please welcome, sir.
Good evening, everyone. Thank you, President Jaydev sir and Suresh sir and Shekhar sir for inviting us here in the first place, and thank you all the staff of FTCCI who actually spent enough time to have a thought about their health and especially spine health. First of all, I am Dr. Suman. I am a sports medicine physician. I've done my MBBS and then I went on to do my MD in sports medicine. So I specialize with athlete healthcare, and right now I'm working more in a spine segment as well. So I worked with professional athletes. I understand the concept of exercise, but when we talk about exercise in professional level, definitely the intensity of the exercise is going to be very high. So you must be thinking, oh, this guy is coming from athlete population and what is he going to tell us? But exercise is something very unique and individualized to each and everybody. Even in professional sport level also, not everybody can exercise like a Cristiano Ronaldo. Maybe they will exercise in whatever intensity they can. So for them to improve their performance at a certain level, they'll have to increase their intensity of the exercise. Okay, so let's dive into spine health. This unique platform of Ensure Healthy Spine is predominantly for people who are sedentary in life and also who are into exercise also. I just want to have this session is very interactive. So can you all raise your hands who all are exercising regularly? Oh, that's wonderful, sir. Wow, that's good. So whenever I talk or whenever I speak to one of my patients also, I try to understand whether the person is into completely exercise or the other category where people are not yet started their journey in exercise. So every person will have their own journey in exercise. It's not like if somebody is looking fit or somebody is exercising, or maybe if they have gone to the gym for a month or 2 months, doesn't mean they are really fit. So exercise as such is a continuous ongoing process. Even though professional athletes do exercise, they will still undergo injuries. So when we as sedentary people, when we are sitting, it's very common, and I think it's the most common thing that everybody would have experienced some kind of back pain or some kind of neck pain at one point of time, 100%. So what brings us to have a very healthy lifestyle, or how we have to understand whenever we talk about a spine problem, a neck pain or a back pain, one of the most important things what we have to understand is what is the root cause of this pain. Whether it is more of related to our structure or any function particularly which we did. Like a lot of people, when patient comes to me, I'll ask them, did you do something in the last 1 week or 10 days which actually is not of your own routine? Then they will think and say, yes, actually I traveled long, or maybe I've driven too far, or maybe I've lifted something heavy which I'm really not used to. So some kind of physical ailment or some kind of history will be there for them to actually get that. Or the other way is, people have this pain since ages. They would have just left it, and then it would have become a habit for them to live with the pain, and then suddenly it shoots up because again there is some abnormality developed over a period of time. So all these things have to be taken into consideration when we are talking about back pain or neck pain. So first of all, if we see in this fast moving life, everybody is into some kind of other stress. So what we generally tell is a healthy mind brings a healthy spine, because there are so many nerves coming from the brain, all are going through into the spine and then going to the body. So whatever stresses you carry, everybody will say, yeah, this could be because of the stress, but nobody will say how to get out of that stress. So it's very, very essential for each and every one of us to have a healthy mind, and how to kind of come out of that excessive stress based work life or anything which they have stress in, to come out of that and then lead a healthy life. So healthy mind will definitely have an impact on it, because everything what we do, like the thought we have or the action we do, is only coming from the brain. So it's essential that we have a really healthy mind. For that, what all is essential is your healthy habits. We all want to have a healthy lifestyle, but we don't want to have healthy habits, which is very, very controversial, which is very, very crisscrossed way. To have a healthy body and healthy habits, right from the start of the day to the end of the day, whatever we do, it has to follow in a track that you live a healthy life. Let me break down each and everything now. First thing first, when it's my request probably to start exercising in some form, whatever exercise, whether it can be a simple squats, whether it can be a simple use your stairs in the house and then just go up and down for like good 5-10 minutes, that is also an exercise. So exercise doesn't mean just going to the gym at all. Exercise means simple things which we can do it at home, and try and slightly increasing your heart rate and then relaxing, okay, but making sure there is movement at every end of the body, like whether it is wrist joint or whether it is elbow joint, whether it is shoulder or neck or the back or legs. We have to make sure we are exercising on a regular basis. If not regular basis, in a week, if you take a week into consideration, maybe a 2 to 3 days a week to start off is also very, very good. Okay, so along with that, whatever we eat is very essential. So if I ask anybody, okay, can you please give me a little insight on your diet, they'll say, I'll eat very healthy, only very little bit, only at this time, only all these things they'll say. But when it comes to if I ask at what time you have your dinner, they'll say 10:30 in the night. How can that be healthy? It can never be healthy. But I know, I'm sure we all work and go back home late and then eat healthy, but all that change has to happen even in the timing of the diet as well. It's essential. What normal diet we have, like our rice or curries, it comes under macronutrients, the bigger nutrients, but the micronutrients are the vegetables. I keep asking everybody, how many vegetables or how many times you eat vegetables in a day? The answer will be 0. Maybe 8 out of 10 times the answer will be 0. But it's very essential to focus our diet on those micronutrients as well. So you're again coming to the same point. We want a healthy spine, but then we don't want to follow all the healthy habits in a day. But these kind of changes have to happen to have a healthy body and healthy habits. So this is a normal spine curvature. So I'm just trying to show you this curvature, because if you can see, there is curve in the level of the lower back and as well as in the upper neck region, which is towards the in this way, okay, like the C shape. So if we don't sit straight, or if we don't sit in the right posture, we are going to spoil this curvature. And if this curvature is not the way it should be, that's when we are inviting problems. First and the main reason why anyone gets a spine problem is because the normal curvature is being altered over a period of time. Let it be if we are sitting in the office, or if you are sitting in a car, or if you are sitting anywhere, if the posture is not right, definitely there will be alterations in the muscle level. Okay, So these are the few facts about the spine health. Again, I think Naresh sir mentioned all these things about the leading disability of in the very active active age work group, and then one of the most common reasons why people take breaks, or 70% of the population have this. If I have to say 70% of the population at some point of time, this is excluding kids. If we ask kids after 10 years, everybody will have this problem, because all of them are sitting in front of the screens only. So that is also one main reason why we get these problems. So exercise is definitely helpful, but knowing what exercise to be done, or knowing right way to do it, is very essential. So I'll just run you through common imbalances. I think you'll all be much be interested. So if we see our structure from the side, like this side, this hip region is, if it is turned forward or if it is turned backward, these are two major abnormalities we see in our clinic every day. If you see that whole the blue color ring, if it is rotating clockwise, then your pelvis is shifting towards forward, it's going forward, and it is causing too much load on the back. It is creating a lot of tension in the muscles. So the right side picture shows two muscles on the up and then one muscle in the down. So those two muscles, the alteration of their structure will happen, which leads to either spasm in the muscle, which leads to pain, or weakness in the opposite muscle. So main reason, and even if it goes in posterior, the anti-clockwise direction also, too much of rotation can also pain in the other way around. So these are the two main problems: anterior tilt and the posterior tilt of the pelvis. Anterior tilt, as I said, when the hip joint is rotating in clockwise direction, and if it is rotating in anti-clockwise direction, it is the posterior tilt. But the good posture is definitely the third picture, which is straight. Ideally it has to be like that. And one of the main reasons people end up in having back pain or knee pain is also because of their foot position. We generally do a whole spine examination when anybody comes to the clinic, and we observe the position, the way they are walking, the way they are putting their step. When they are putting their step, either their feet is going in direction of the first picture or the last picture, so, or it is straight. Very often we see this abnormality. So for this particular thing, we get a foot analysis done to give them proper insole, to get the foot correction done, which will reduce the pain in the knee joint and as well as in the spine. So one of the leading causes for the back pain and the knee pain as well. So this picture should actually tell everything what we do when it comes to spine health, because if we observe this, when we see a patient in the clinic, we see both the shoulders, whether they are in same line or not. Then comes to the rib cage, the spine which is attached to the rib cage, whether it is in straight line or it is in towards one side or rotated towards the other side. So, and then at the level of your hip joint, whether it is towards up or down. Naresh was talking about pelvic tilt and all. So whether it is towards one side, dip towards one side, or lifted towards one more side, we will have to see, because all these things happen because of muscle imbalances. So our job is to identify what muscle is imbalanced and how do we give treatment. So all these things, definitely when you go to the hospital, you immediately people will ask for X-rays and MRIs, but this kind of clinical examination is very important, and to understand what is the root cause of the problem, again coming back to the root cause of problem. So if a lot of people, when I was in a sports team, so in sports in India, I mean in India, anywhere in the world to be frank, when an athlete is getting an opportunity and he is injured, he doesn't want to tell that I am injured, okay, because he might lose his chance. But we had to make them understand that, are you ready to lose the next 6 months, or will you lose only 2 weeks and then go back to play after 2 weeks? So the question is whether you are trying to prevent.
6 months, 6 years.
Can be, sir. Maybe 6 months or 1 year if they are a professional sport. So if they have all the support to do all the rehab and all that. So the question is always to make them understand it's okay to lose 1 week or 2 weeks of game, slow down, take care of yourself, and then go back and play again. A lot of people get injured like that. Now the same thing I keep telling this to all the IT professionals also, or people who are sitting in front of the desk and working. If you have this kind of problem, you make sure you address it and you move forward. If you don't address it, the problem is if you don't address it, you might as well take a medicine and then the pain gets masked and then you will move on. But then the next time the problem comes, it will be reversible. So even a person sitting in a if somebody has a business or if they have taken care of the business, I know it's very important to go and check their work life, but taking care of themselves is equally essential, because if they are going to lose that 1 week or 2 weeks, then the injury might actually progress badly and might as well take more time for that to recover from the surgery. So this is the basic clinical assessment we do at our clinics. This is the way we examine spine, though the person has a normal spine. If we see the X-ray of the spine, it is more observed from the neck to all the way up to the hip. So if you see, there is a clearly tilt in the spine. If you can see that, observe in the second picture, the spine is not straight like this, it is like this. So now at that particular time, we will understand which side muscles are in tightness and which side muscles are in weakness. So to do one side of the muscle, the other muscles will overcompensate and then cause a lot of imbalance. That has to be identified and treated immediately. Now we are actually moving into very tech free zone. We are trying to get something called a 3D spine analysis, in which the machine will be like that and the patient has to stand in front of the machine. Then through infrared rays, this is not X-ray, there is no radiation, through infrared rays, the details of the exactly, if you see the level of shoulders, the spine curvature, the pelvis level is measured through infrared rays. We are in the verge of getting it as early as possible to our clinic, which will probably scale up the number of the accuracy and also the volume of the people getting tested. So these are the some. Sir, so this first we do it for spine, and along with this we are also focusing on a foot analysis. When we do foot analysis, it gives an analysis right from the foot to the knee joint and to the hip joint. So it will help us.
If you see on the first picture, the lady is standing on the plate. That actually captures your force plate, your load on your joints. So there are different ways of analysis, right? So this gives you the entire from head to toe, but focused on spine, because if there is any spine curve alteration, it immediately picks it up. And all these analysis you saw, the other two right side images, sir, it's using an infrared camera which picks up a good muscle imbalances. Second is structural. And they're also one of the professor of biomechanics, movement biomechanics, not a structure, movement. When you're walking, how does the biomechanics are altered? Because I visited that company in University of Roma in Italy. So they have put AI now. Because AI takes the normal shoulders and the bony landmarks, right, which is supposed to be human structure. So any variations, it immediately detects also. The reason we are going for that is we wanted to scale this. I mean, we can put it in every, large companies, workplaces also, make it a regular change. And it also allows pre and post also, sir. I mean, so, Dr. Suman found it and we are at the verge of partnering with them. I mean, and also do some little bit of our own Indian research.
So initially when I was trying to show the curvature of the whole spine, whether it is cervical or thoracic or the lumbar, this particular machine actually is identifying the minute details of the curvature also. If there is increase in the thoracic vertebra, or if there is decrease in the cervical, all that minute details also it's capturing and giving us a lot of data, which can help a lot of people to prevent many spine related problems. So these are some corrective postures to prevent neck and back pain. I'll just put it up. How often we bend ourselves down directly to pick something? It's very common. We are working, we are writing something, the pen falls down, immediately we do this. But it's definitely not a healthy way to do that. The ideal way to pick it up is use your knees, use your hip joints, bend down properly to pick it up. Like even when we try to, especially young mothers and young fathers, they just do this and pick their kid up like this, and they will have a catch. They come to our clinic. When asked any detailed history, they will say, I was actually trying to pick my baby, and then I had a spasm or I had a disc coming out. So it is ideal to hold like this. Just use your knee joint and hip joint also to do the movement. I'm sure people who exercise will know when they are doing squats or lunges. So that is one thing to do. And then even when sitting also, it's the most common and the most terrorizing not only your staff, sir, everyone staff. If you ask me, most of the IT sector or people who are just sitting in front of the computers and working, how common it is for them to just go and see like this. Absolutely, I can see that, sir. I can see that. And
nobody sits, my dear, like this.
And sir, the reason why they don't sit like this for a too long time is their muscles don't support them to sit like that for a too long time. Because of the muscle weakness also, we'll sit like this for some time and then slowly we'll go into this position. So for that, let's say not all the individuals are of same height. The height difference is too much in our population. So it should suit, the chair should suit the person when they are sitting. If you look at that picture, the person sitting correctly has his hip and knee joint in a straight line, and then the feet, the leg going directly in 90 degrees angle. That has to happen for them to sit upright straight. If that is not happening, or people who are just sitting and putting their legs down like this, all those problems come. Okay. Sleeping position again, very frequently that people just sleep like this, keep a hand under the pillow and then sleep. Next day they come and say, they complain, I have a severe shoulder pain, doctor, what should I do? Again, when I go back and ask, when they are sleeping in a side position, this will be the point of contact in the bed. So the distance between the ear and the shoulder has to be covered with a pillow, sorry. Okay. So ideally your spine should be in a straight line even if you're lying down. So ideally, if we see the position of the shoulder here, sir, shoulder to the neck, that space has to be filled with a pillow which is big enough. People either use a very small pillow, or they don't use a pillow, or they use a very big pillow which can cause spasm, so which can cause pain in the neck muscles. So correct posture is either sleeping straight.
We have been taught that if you don't use pillow, that is the best way.
Sir, that is when you are lying down straight. Okay, that too you can use it. You can roll up a towel, Turkish towel, and put it under your neck. See, I told you neck position is lordosis like this, right? So sitting we make it like this, and then while lying down, the neck is used to be like this. Now again you are doing this. So there should be some support here. If not a pillow, just a support which will make sure there is curvature formed in your neck joint.
But in our
అవును సార్. ఆ దిండు ఉండాలన్నప్పుడు కరెక్ట్ సైజ్ పిల్లో ఉండాలి సార్. అంతే, ఆ పిల్లో సైజ్ ఒకటి కరెక్ట్ ఉండాలి. అది ఒక్కొక్క ఇండివిజువల్కి డిఫరెంట్గా ఉంటుంది. అప్పుడే మనకి డిఫరెన్స్ వచ్చేస్తుంది. ఎగ్జాక్ట్లీ. మళ్ళీ సైడ్కి పట్టుకున్నప్పుడు కూడా చాలా చిన్న దిండు పెట్టుకుంటారు, అప్పుడు నెక్ ఇలా అయిపోతుంది ఒక సైడ్లో, దానివల్ల ఇదంతా స్పాజంలోకి వెళ్ళిపోతుంది. అట్లా అదే 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 సో so there are certain patients who have come to our clinic and then we have identified their deformities and then corrected. I would like to show few of them, sir. I will not take too much of your time, sir, if anybody is getting it. So if you see before pictures lo, first picture, if you see, this person is a 17-year-old badminton player, very aggressive badminton player, and whenever any player comes or anybody comes, I take a detailed history. I was asking him how much time you are playing badminton. He is saying I'm playing 3 hours in the morning, 3 hours in the evening, 6 hours of game, and then in between he will go to the school or college. And then I was asking him what is your diet routine. I will ask him what is his sleep routine also. He was telling me he will sleep at 12 o'clock in the night. I asked him, give me your phone once. He gave me. Poor guy didn't know what I'm going to do. I asked him to open screen time. His screen time was around 6 hours. I asked him, see, you're playing 6 hours, you're going to college maybe 5 hours in between, and then your screen time is 6 hours. Where is your rest? How will your body recover? How will your mind recover from the whole sport? Because of which there was too much of over usage of one side of the shoulder, and his shoulder is like this. When he came to me, he was like this. So within 4 weeks we had corrected his spine, and enkala, what those bones are called as scapula, these bones are called scapula bones. So that correction we had to do for him. It took some time for him, but he got it corrected, and then now he's playing.
Badminton,
yes sir,
badminton is played by one hand only.
Yes,
Right? So maximum right hand.
Right hand, dominant hand. Yes.
Some people play with left hand also. There is a difference, but only one hand.
Yes, sir.
Always when they play by one hand, that only one hand will be all right, or some damages may occur
Yes.
in the one hand. What about the other hand, which is not there is no movement like your other hand, like right hand? So what will be the difference?
So that's
He is the right person. He plays.
Both hands are used for badminton. The muscles are trained both. Without the left hand, right hand, नहीं मार सकते.
सर आप समझो कि
entire shoulder is used when you are hitting a shuttle.
exactly.
So both the muscles play.
सर आप समझो कि
I
आप
can't keep my hand like
you're playing right handed. Imagine you tie your left hand to the waist with a belt and then play. You'll play? No. So the moment, sir, in fact the force when you hit doesn't just come from the shoulder. Your trunk rotates, your pelvis rotates, and then you do this. Similar example is in tennis. Imagine tennis serve, the ace serve which comes at 140 kilometers per hour. It just cannot happen with your shoulder. It has to come all the way through the rotation of the spine, forces from your leg.
Total body.
Exactly. So energy sir, when we are talking about muscle, it is called as kinesiology. Kinesiology is study of movements. The energy flows in a kinetic chain. It will flow in a chain which generates force, and also if not used properly, it can lead to injury. It's like that. So
force comes from the toes.
yeah, all the way from the toes.
Don't put your foot on. यहाँ से toes से strength आता है, which comes from the wrist.
Absolutely. Only specific shots will have this wrist movements like this, but then eventually the smash which they do comes from full. Sir, this particular person underwent a spine surgery. When he came to us, if you see in the first picture, his spine is slightly tilted towards one side, which is the left side. The right side is slightly hiked like this, and then we put him on an extension based exercise, just simple extension. He actually, if If you see the first picture, you will see it is looking normal, but if you see the second picture and then look the first picture, you will understand, oh yeah, actually second picture his particular shoulder girdle is much more broader, and then by the time the waistline comes, it is much more narrow. The same thing is not there in the first picture before training. But again, he also took good 4 to 6 weeks time with us. Sir, this particular person actually had this spine curvature and he had pain. He had come with active pain. He is a software employee and he is living in US. He has come here for only 1 week, and fortunately we could recover him in 1 week. He took 4 days time to see this correction and he went back happily. We are still in follow up with him once in every 2 weeks. He will do exercise with us online. He is a special condition, sir. He is a rifle shooter. When I asked him, rifle shooter, what is your position? He said this is going to be his position. So his left side shoulder is slightly hiked like this, and he had pain in the neck and as well as in the lower back. So he also took around good 2 weeks for recovery. We had to do a lot of muscle corrections. If there is a spasm, we had to intervene into the muscle, release the muscle, and then put dry needling, and then he recovered. Now he has gone back to his shooting. Shooting as his, he says, it is my profession. I do it regularly. He practices maybe. Sir, this particular person, he came with a limb length discrepancy. What Naresh sir was telling, his position was like this, sir. When he came, like this. And if he has to walk, he has to do this, and then he is walking. So whenever he does this, his spine is going towards one side. So for him, we had to do foot correction first, get his foot to almost near normal. It was not normal, it was slightly still less. Then we had to do his correction of the spine and give him exercise. This person was in extreme pain. He was not able to function at all, but now he is continuing his exercises. He is doing very good for himself. Mr. Ram Kumar also, he is a again software professional only. He had a spine surgery. After spine surgery, he didn't do his rehab at all. So when he came to us like this, we did the whole spine X-ray to find out the position like this towards one side, left side. He took around a weekday's time. Basically he recovered very fast. His name is Siddharth. Again, he is a software employee from USA. He also came with the pain. He was unable to sit at all, and we had to identify this curvature problem, got it corrected. He is doing good for himself now. So he is one basketball player, sir. He has come very recently to our hospital. First video play chestarandi. So when we asked him to bend forward, so he was not able to bend on his own, and he was having pain, severe shooting pain here in this right side glutes. He was not able to bend at all.
Same put face na side, just bend down.
He was in pain. So his spine was going towards one side. Put a second video please. This is exactly after 1 week to 10 days. So first video lo there was no hip joint movement, sir. Movement avatle hip joint, rotation avali kada, that was not there. Now in this thing, he was able to use his hip joint better and then bend his spine forward. Yes, sir. Yes, because he was not doing weight bearing on that side. He was only doing like this. Mottam weight right side lone pedutund. So for him to bring his weight in, we had to add ankle weights, and then we had to teach him. But again, he still has some amount of scapula problem undi ippudiki kuda, right, left side lo. He's undergoing his recovery. He's a basketball player. ఏంటి సార్ అదే
Yeah, that's what we're getting to.
Madam, see, one thing, we definitely will teach the ways how to sit straight. You know, madam, indake cheppanu kada, if somebody has to maintain a posture, sit straight for a long time, their muscle groups have to be active. So first nunchi exercise cheyali, exercise is very important, regularly working out is important, and in a reason because that is going to be the answer in the end. So not
sorry.
yeah,
Exercise also you should do with awareness.
absolutely,
A
sir.
lot of people say I go for walking every day.
No.
They are damaging their spine. While
Absolutely.
walking you should observe every second your posture and everything. You're doing cardio exercise but you're damaging the body. So you need to.
Walking.
Sir, walking lo, sir, I would like to say this, sir, because my father is a general medicine doctor, and whenever I used to go to clinics with him, he invariably says, "Meeku sugar undi, walking cheskopondi." So it's been there in our books also. Diabetes treatment part lo last lo 30 minutes of walking అని ఉంటుంది, and people just kept telling that. బట్ మరీ స్పోర్ట్స్ సైన్స్లోకి వచ్చి ఇంపార్టెన్స్ ఆఫ్ మజిల్ వచ్చే వరకు ఎవ్రీబడి ఈజ్ వాకింగ్ ఆల్రెడీ. బట్ వాకింగ్ ఈజ్ నాట్ బ్యాడ్ థింగ్, సార్, బట్ వీ షుడ్ నో వెదర్ ఆర్ వి వాకింగ్ ప్రాపర్లీ ఆర్ నాట్, అండ్ వైల్ వాకింగ్ ఆర్ వి స్టెప్పింగ్ కరెక్ట్లీ ఆర్ నాట్. ఇప్పుడు స్టెప్ ఇలా మనం స్ట్రైట్గా పెడితే ఓకే, బట్ ఇన్స్టెడ్ ఆఫ్ ఇట్ మీకు ఒక ఫుడ్ పొజిషన్ చూపించాను చూడండి, ఆ ఫుడ్ పొజిషన్ ఇలా వెళ్తుంది అన్నప్పుడు మాత్రం అది ఎవరైనా చెప్తే వీ హ్యావ్ టు గెట్ ఇట్ కరెక్టెడ్. వాకింగ్ యాజ్ సచ్ ఈజ్ ఓకే, డీసెంట్, బట్ వాకింగ్ ఈజ్ నాట్ లైక్ ఎక్సర్సైజ్. చాలామంది చెప్తారు సార్, టు బీ ఫ్రాంక్, ఫస్ట్ థింగ్ దే విల్ సే ఐఎమ్ వాకింగ్ ఎవ్రీ డే.
Your back is weak.
Yeah, you will walk, you will, absolutely.
By walking you're damaging. You
Strengthen the muscle and then walk, exactly. So walking gaani, cycling gaani, running అయితే lot of women run on treadmill and they come to us, madam. First question I'll ask, what was your goal? What was the goal for you joining gym and doing treadmill? They will say first thing is weight loss. Most common concern for women in 30 plus age group is they want to lose weight. Inka younger people kuda ela cheptarante, so I am already engaged, so within 2 months I am getting married. Now my in-law should not recognize me in 2 months antaru. That is their goal anta, sir. So I should run very fast antaru. No, that's not the way. It doesn't happen like that. Huh?
walking in the morning, out of 10, 5 people in KBR.
Yeah. And
That is bad.
so madam, see, my whole strategy of exercise is we should learn simple exercise for back, simple exercise for upper back, simple exercise for lower back, and konni very few exercise ante there are a lot of aspects, madam. One is strength, one is endurance, one is flexibility, stability, mobility. ఇవన్నీ కూడా చాలా ఇంపార్టెంట్. ఈ ఫ్లెక్సిబిలిటీ, స్టెబిలిటీ, మొబిలిటీ అనేది స్మాల్ ఎక్సర్సైజ్ తోని వీ కెన్ టీచ్ అనమాట. సో దోస్ థింగ్స్ హూ ల్యాక్స్ స్పైన్ మొబిలిటీ ఆర్ హూ ల్యాక్స్ స్టెబిలిటీ వెన్ దే ఆర్ వాకింగ్, అంటే వెన్ దే ఆర్ స్టాండింగ్ అంటే ఇలా నిల్చుంటే ఓకే, సింగిల్ లెగ్ మీద నిల్చోమంటే స్టేబుల్ ఉండరు, ఇలా పడిపోతుంటారు అనమాట, బ్యాలెన్స్ ఉండదు. సో ఆల్ దోస్ స్మాల్ థింగ్స్ ఆల్సో ఆర్ పార్ట్ ఆఫ్ ఎక్సర్సైజ్ ఓన్లీ. ఇట్ డజన్, స్ట్రెంగ్త్ ఈజ్ నాట్ ద ఓన్లీ ఎక్సర్సైజ్. ఆల్ దీస్ అదర్ థింగ్స్ ఆల్సో షుడ్ బి ఫోకస్డ్ అండ్ షుడ్ బి టాట్. ఒకసారి నేర్పిస్తే అది ఏ టైమ్ ఆఫ్ ద డేలో చేయాలి, మార్నింగ్ చేయాలా, ఈవినింగ్ చేయాలా, లాట్ ఆఫ్ క్వశ్చన్స్ కమ్ టు మీ. ఇఫ్ ఐ హ్యావ్ టు ఆన్సర్ దట్ క్వశ్చన్, మేము మార్నింగ్ ఎక్సర్సైజ్ చేయాలా, ఈవినింగ్ చేయాలంటే, ఇఫ్ యు ఆర్ నాట్ ఎక్సర్సైజింగ్, స్టార్ట్ ఎనీ టైమ్. If somebody who you are into exercise and then you have to think about lot of things. If you are comfortable doing in the morning, that is very good. But morning levvadaniki avvadu, nidra I cannot get up from the bed in the morning ante, evening also you can do, but make sure it should not be after 7:30 or 8. It has to be before that only. ఎందుకంటే ఎక్సర్సైజ్ చేసినప్పుడు మన బాడీలోని అడ్రినలిన్ రష్ ఎక్కువ ఉంటుంది సార్, దట్ విల్ ప్రాబబ్లీ మన స్లీప్ని ఎఫెక్ట్ చేస్తుంది, కొన్నిసార్లు నిద్రపోనివ్వదు. లాట్ ఆఫ్ ప్రొఫెషనల్ అథ్లీట్స్ హూ ప్లే ఇన్ ద ఈవినింగ్, ఇప్పుడు క్రికెట్ అని వీళ్ళు క్రికెట్ ఆడతారు, ఫుట్బాల్ ఆడతారు, దే విల్ హ్యావ్ స్లీప్లెస్ నైట్ సార్, దే విల్ టేక్ మెడిసిన్ ఫర్ స్లీప్. అంటే సింపుల్ మెలటోనిన్ ఇస్తారు, వాళ్ళు తీసుకుంటారు. బికాజ్ వాళ్ళు పడుకోవాలి, మళ్ళీ నెక్స్ట్ డేకి రికవర్ అవ్వాలి. సో అయితే వాళ్ళు గెలిస్తే అసలు పడుకోలేరు, ఓడిపోతే ఇంకా పడుకోలేరు. సో అట్లనే మనం కూడా ఎక్సర్సైజ్ చేస్తే మేక్ షూర్ వీ డూ ఇట్ ఇన్ అ సర్టన్ టైమ్. అండ్ సింపుల్ ఎక్సర్సైజ్ కెన్ బి టాట్ మేడం, depending upon one's weaknesses and strengths, we'll figure out an exercise chart for them.
Finish this.
Yeah.
Then we'll go. Madam is asking the practical session.
Okay.
So let us be very focused for the main employees here.
Fine.
What is that
Okay.
exercises?
Sir.
Rather than exercise, as I say.
Sure.
1,
Sure.
2, 3, 4 checklist for everything.
Okay, sir. Okay. So what we'll do, madam, instead of giving a assessment here, we will give you basic stretches and basic exercise, I think, which everybody can do in sitting position or standing position also. I think that will be better. Okay. Yeah, this is done, sir. This is almost over. Yeah, thank you.